Dear colleagues, dear friends, dear experts and practitioners on occupational safety and health. This year we are celebrating the World Day for Safety and Health at Work in very special conditions created by the spread of coronavirus. The ILO already intensified the technical support we are offering to the countries during this pandemic, and we also take into account the post-crisis consequences and assistance. Among several materials prepared by ILO, especially for this celebration and focusing on occupational safety and health aspects related to COVID-19, you can see on the screen behind a briefing of the presentation, which we recommend as a useful tool tackling particularly with this topic. All of us, we noticed an unprecedented high speed of transmission worldwide, accentuated by three main factors: global integration, travels, and urbanization. This pandemic has a severe impact on the world of work, and we are now facing increased unemployment and underemployment, worst occupational safety and health and working conditions, and reduced access to social protection. We have to mention as well particularly negative effects on specific groups more vulnerable to adverse labor market outcomes. We have to emphasize that according to ILO standards, protecting workers from the risk of contagion during an outbreak is highly important in this period as part of occupational safety and health rights and responsibilities. Assessment of the risk of contagion at work. It is very important, and here we are talking about probability to be exposed to the risk of contagion and severity of the resulting health outcomes, taking into account individual affecting factors. Emergency response workers, like healthcare workers, but also workers in essential activities, are facing a high risk of contagion by the nature of their work. This is why the necessary measures to prevent contagion must be put in place. You can find all these more detailed in the presentation. As I mentioned in the introductory part, a special attention must be paid to vulnerable groups of workers affected by the pandemic. For example, informal workers. They may need work despite restrictions of movement and social interaction. They may not be able to comply with occupational safety and health measures and precautions, and they may lack sufficient protection, like, for example, social protection, sick leave, unemployment benefits. Stress and psychosocial factors during a pandemic must be addressed as well, and ILO recommends that some of these factors, like fear for own health and well-being of that or family members and co-workers, lack of safety equipment for personal protection, isolation, lack of social support, tension between established safety protocols and the desire to care for support individuals, difficulties in maintaining self-care activities, for example, exercise, good eating habits, rest, must be taken into account. The ILO key pillars in responding to COVID-19 crisis are following: stimulating the economy and employment, supporting enterprises, jobs and incomes, protecting workers in the workplace, and relying on social dialogue for solutions. We also emphasize the need for occupational safety and health to be integrated into government crisis responses. A particular role should be granted to occupational safety and health practitioners. They will facilitate access to reliable information, they will promote understanding of the disease and its symptoms, and they will support in the risk assessment and management process. They can play as well an important role in development or update of plans for prevention, containment, mitigation, and recovery. Thank you very much for following this. Stay safe.